जी जी
Okay, so
जी
yes, madam. First of all, a brief introduction of Madam Dr. Gauhar Afshan. She is Tajdin Hussain Jafar Endowed Professor of Anesthesia and Pain Medicine at Aga Khan University, Pakistan, founder of multidisciplinary pain setup in Pakistan, and former chair Department of Anesthesia, and is currently heading the section of pain medicine at Aga Khan. She is the deputy chair of Pain Management Committee WFSA and member 2025 Global Year Task Force IASP. Over to you, madam.
जी thank you very much Sadia for a very nice introduction, and thank you very much for STSP for this opportunity and this topic, which when Atik told me first, so I thought that I asked him not to, you know, take this session because of the reason. The one reason is that because currently this cannabis is not legally approved. I am very much into the research of the cannabis because at the time when I started this research in cannabis, it was about to legalize in the country. But in our country, when the government changes and these things would also changes. So currently in Pakistan, this is not legal. So I really want to emphasize this one, that whatever we are reading or studying, this is for the purpose that cannabis is the future most likely, and we have to know what the cannabis is, how the cannabis would work, and how the world, the globally, the people seen as a cannabis. So the topic was given to me, cannabis and chronic pain. I just added, apology Vidyatik, I added the hope or hype, because it was in my mind when I was making this presentation that what should I tell this audience about this cannabis, who are the practicing physicians and who are, currently the pain fellows or the pain residents, and the future may they may want to use that chronic pain. So they must know some of the basic knowledge about the cannabis and in chronic pain and how this can be used. I want to declare my, conflict, because currently I'm a member of a research group which is working on cannabinoids, and we were actually looking for a various aspects of cannabinoids, not only the pain, but the cannabis currently are being used for many central nervous system diseases like Alzheimer's and dementia, also in certainly cardiovascular disease. And very interesting area is about the cancer prevention, and the two cancer prevention that people are talking, the cannabis use in cancer prevention is uh, is especially the cancer recurrence. The prevention of the cancer recurrence is the prostate and the breast cancer. So currently we are working for a different angles, and anti-inflammatory effect and all these things. And we are basically, our interest is to work the cannabis, the locally grown cannabis, because whatever literature we are reading, most of the studies, they are done in uh, Israel or in Canada, the other part of the world, in Europe. So their cannabis, certainly, because we know this quality is different from person from soil to soil. So we really want to see the locally grown cannabis in an area like Aptabad, in the northern area of Pakistan. So our own interest is to see the effect of the locally grown cannabis on the chronic pain and other things. So this is also, I would like to share that one of the uh, research theme in our university, and I'm very actively working on that, is to see the opioid alternatives for the developing world. We all know that because of the various reasons, the narcotic policy and the supply chain problems. There's so many hurdles providing the opioids, and sometimes we are desperate that if opioids is not there, what is the opioid alternative for the developing country. So this is the one issue. Now let's start to giving the basic background of what the cannabis. We naam se to bataiye, you know all that cannabis is the most popular and useful medicinal plant. If you study this, the literature about this plant, you found that this is a very old plant, 27.8 million years old. History tells us that, and it is used in traditional medicine in China and has been reported, other than the China, the use of this plant for many problems, many illnesses, including the central nervous system illnesses. Uh, Currently, and this is important, that till today, we have been found 120 cannabinoids, 120 cannabinoids. So there's so many varieties, and not all 120 cannabinoids are being used. So normally, when we talk about chronic pain, the two cannabinoids actually came into our mind. One is CBD, which is cannabidiol, and secondly is the delta 9 tetrahydrocannabinol, THC. So CBD and the THC out of 120. So you can imagine there's so much potential in this plant having 120 cannabinoids still today, and it may increase. Maybe people think that the way the research is being done, you may end up with the more than 500 types of cannabinoids from this plant. Some cannabinoids from the flower, some from stems, and roots and leaves. So many sources. But currently we will talking mainly about the two cannabinoids out of 120, which is THC and CBD. In the recent year, there is a growing debate about the use of cannabis for a variety of medical conditions. As I earlier mentioned, that we are interested mainly for this forum, we are interested mainly for chronic pain, chronic benign versus chronic cancerous pain. But other than this, this medicine is being used and is being tested, and so many trials are being done for cardiovascular and central nervous system, the two main areas. A lot of studies and very fascinating work is being coming out from for Alzheimer's and dementia. So the medical use, as I earlier mentioned, the medical use of cannabis is not legal in Pakistan yet, although I know that some of the physicians are using them. Also have used in 2020-21, when at that time the government did not allow the license, but they temporarily they are allowed to start then. And after this small, brief use, we jump towards the only lab studies, because later on, after 2022, this new government is actually hold all these kind of a cannabis for even for a research purpose. So because our research has been approved from the ERC, so we have been still doing on, and this is not being used on patient. It is basically in the lab research work. So that when we use the medical cannabis, when we use the term, this is the medical cannabis, that means that the physician actually recommended. It's not that the person who just went to the, nearby plant and just try to get it. No, when the physician writes uh, cannabis for some purpose, whether for anxiety, for depression, for pain, for dementia, whatever, then it is called the medical cannabis. The recent scientific evidence also demonstrate that the cannabis may be clinically useful for the treatment of chronic pain, and it seems to be safe and tolerable for long-term use. And that is the most important thing, because in some of the chronic painful condition, we know that these are not going to go away. The arthritis is not going to away. Some of the chronic degenerative pain is not going to go away. Rheumatoid arthritis, a lot of patients, suffering from them. They often use non-steroidal and, damage their kidneys and the steroid and, so many medication. So when we know that the pain is not going to go away, it will remain with you, then certainly for the quality of life, we have to give something. And for those kind of a thing where the patient can safely take for a long-term use, and they will not be dependent on such a blessing for such medicines. So after the introduction, I just emphasize because in the limited time of 45 minutes, we will not take all the issues related with the cannabis. So objective, I said basic 2 or 3 things. First, what is the most up-to-date evidence about the basic science of cannabis? And this is important to understand the basic science of the cannabis. And whenever we'll study it in the next few slides, please remember that and compare that with this intrinsic system of opioid. You know that the opioid receptors, the mu, the kappa, the signal. Similarly, we did not knew years and years that the cannabinoid receptors also there in the body, and this kind of a fascinating basic science that we'll review. We'll also then discuss about the therapeutic importance of cannabis, considering its long-term use as an analgesia, as I just mentioned before. And we also talk about the what is the current status, what the world is using this chronic, this cannabis for chronic non-cancerous benign pain. So the basic sciences, it is fascinating. Whenever you start reading anything new, then always start with the basic thing, because if you understand the foundation, then the other part make you, engaged in such kind of a sciences. So as I told you just before that, remember, whenever we talk about endocannabinoid system, ECS, just compared with the opioid, the intrinsic opioid system हमारी body में. So the endocannabinoid system has emerged as an important neuromodulatory system in last 2 to 3 decades. And this is the most rewarding achievement of the ECS system, that it has a very, very important role of neuromodulation. And when we talk about the neuromodulation, the people who are practicing pain, they know then the patient come with the neuropathic pain, then how you are, sometimes you're so frustrated because neuropathic pain is not easy to treat. And you try the many neuromodulatory drugs, the antidepressant, the anticonvulsant, and it's hardly a patient, gets a relief on some of the refractive neuropathic pain. So this endocannabinoid system, ECS, they emerge as a neuromodulator system in the last 2 to 3 decades. It plays several important roles in central nervous system uh, uh, and synaptic plasticity. And this is very, very important, that the response to endogenous and environmental insult, they develop activation of this system. And this system comprise of receptors, which is called the cannabinoid receptors, then endogenous cannabinoids. थोड़ी देर पहले we were talking about exogenous cannabinoid, which is we said this plant may 120 cannabinoids and 2 is a THC and cannabinoid. Here we are talking about the ECS, में body में अपनी भी endogenous cannabinoids हैं, and they are called the endocannabinoids, and the enzyme responsible for the synthesis and degradation of the endocannabinoids. So whenever we talk about this ECS system, so how we will remember that ECS system, which is the endocannabinoid system, in parallel with the opioid system. याद रखिएगा. So it has got receptor, which is called the cannabinoid receptors. There are endogenous cannabinoids that would work at the time of the environmental insult, and the enzyme responsible for synthesis of these degradation of endocannabinoids. When the endocannabinoids comes and they do their neuromodulation work, then they have to be degraded. So there are the responsible enzymes available that are results in the degradation of endocannabinoids. So the endocannabinoid system regulates, modulates, or play a role in the biological function of the human body to experience pain and pleasure. And also the immune function, neuroprotection, inflammation regulation, memory. So fascinating work. So there's so many things happening in the nervous system when this ECS modulates whatever the stimulation is. Okay. Now comes for the first part, which is the cannabinoid receptors. The most abundant cannabinoid receptor is CB1. So remember that this CB1, as I told you before, as I told you before, this CB1 and the CB2, they are the commonest receptors. However, the other receptors like TRP and PRAS, they are also engaged for some other activity, because today's topic is mainly on the chronic pain. So we are just focusing on CB1 and CB2. The effect of the cannabinoids are primarily mediated by CB1 and the CB2. And CB1 are abundant in the central nervous system. ये cortex में भी हैं, basal ganglia, hippocampus, cerebellum, and CB2 are representing at much lower level, which is the microglia and the vascular element. So whenever we use exogenous cannabinoids like THC and CBD, remember the two exogenous commonly used clinically are only the two cannabinoids. Okay? One is the THC and one is the CBD. And they produce the biological effect through their interaction with the cannabinoid receptor that are present in the body, the CB1 and CB2. So इसको सीधा याद रखना है that the opioid system की तरह opioid receptors हैं, endogenous opioid भी होती है. When we use morphine, or when we use tramadol, and when we use nalbuphine, so how the exogenous drugs would go and work through that receptor. Similarly, when we use THC, when we use CBD, they go and they just work through the endogenous cannabinoid receptors. Okay. Now come to the endocannabinoids. Now, exogenous cannabinoids की हमने बात की, that is THC and now endogenous body also has endocannabinoids. So first stage is basically the body itself releases the endocannabinoids. And there are two endocannabinoids are best tested. And they are, one is the 2-arachidonyl glycerol, which is 2AG, and anandamide. The two basic tested, trial and tested endogenous cannabinoids. ठीक है, याद नाम रहे ना रहे, याद रखिएगा, दो ही हैं. So everything is two. Remember that exogenous भी दो की बात की है हमने, which is THC and CBD. Then हमने बात की है रिसेप्टर की, बहुत से रिसेप्टर, हमने दो ही की बात की, which is CB1 and CB2. फिर हमने बात की है जो एंडोजिनस बनती है कैनाबिनॉइड्स, which is 2AG and which is anandamide. So anandamide plays a more crucial role in pain modulation and the body's pain mechanism. So anandamide ज़्यादा effectively काम करता है. So 2AG is more prominently involved in the response to brain injury. Particularly, it is used for neuroprotection and inflammatory regulation following trauma or damage to the brain. So when we talk about the pain or the chronic pain or inflammatory process, तो हम सिर्फ anandamide की बात करेंगे. So I wanted to narrow down all these things because these are basic science and sometimes it's difficult to remember. So I'm again repeating that we just talk about the ECS system. ECS system is composed of these receptors, which is cannabinoid receptors. Then there's endogenous cannabinoids, which are anandamide and 2AG. Anandamide is basically is concerned with us. Okay. Now, very, very important, which actually we are looking for, the analgesic activity and anti-inflammatory. As I mentioned you that there are some of the diseases which certainly is not curable, and we have to manage those diseases, and for the quality of life, the pain relief is very important. So non-steroidal anti-inflammatory drugs and narcotics like opioids is not the solution. So certainly we want something, the good analgesia, having anti-inflammatory properties, not as dangerous as the non-steroidal anti-inflammatory drug for kidney and other system. So it was for years and years, it was assumed that cannabinoids produce analgesia by activating specific to CB1 and CB2 receptors throughout the body, but especially the receptor the present in CNS. This concept has become complicated with a new research finding. And recently, it has been recognized that the cannabinoids act simultaneously on multiple pain targets within the peripheral and central nervous system. So the concept that was years and years we believe that is only in the central nervous system, but now it comes that there are peripheral receptors also present for such cannabinoid things. So what is the proposed mechanism? How this cannabinoid induce analgesia? So there are three, four mechanisms, and not all are agreed or consensus for all these things, but majority believe that first and very important is the inhibition of the neurotransmitters and the neuropeptide release from presynaptic nerve findings. So they act on a presynaptic nerve findings, and where they actually inhibit the neurotransmitter release. Then what happened? Then it modulates the postsynaptic neurons. So it affects on the presynaptic, then the postsynaptic. And then certainly they activate the descending inhibitory pain pathway. And at the end, it reduces the neural inflammation. ना रिलीज होने दे रहा है रिलीज हो रहा है तो उसको फॉर्म मॉड्यूलेट कर रहा है इनहिबिटरी पाथवे भी एक्टिवेट हो रहे हैं सो इन दैट वे द न्यूरल इन्फ्लेमेशन इज कंट्रोल्ड. Now, we talk about the two exogenous. One is the THC and other the CBD. Now, this is important to remember. The THC, we talk about that the anandamide, जो anandamide endogenous होता है, cannabinoids. So, uska analog, the THC, is mainly responsible for analgesic and anti-inflammatory effect. This is a perfect drug that produce analgesia and anti-inflammatory. And so when we talk about the inflammatory pain, there's so many, pain syndrome and variety where the patients complain of pain because of inflammation. Unfortunately, it has a perfect effect, but it has a high binding affinity with the CB1 receptors. And we know when CB1 receptor means the psychoactive property, the central nervous system psychoactive properties. But when the CBD, which is another important exogenous cannabinoids, when they use it, they also have analgesic and anti-property effect. In addition to that, it also got anti-anxiety and anti-convulsion effect. And it is claimed that it has almost no psychoactive effect of THC. So THC के bad effects भी नहीं हैं. Then ये inflammation analgesia के अलावा भी काम करता है, like anxiolysis. It will help like overall quality and good sleep. But it has the perception regarding the perception of it is not as good as the THC. So there's nothing ideal, but as far as the psychoactive, side effects is concerned, certainly you have to look for other. Whenever we talk about such new medication, the first thing that comes in our mind is the safety profile. Is it a safe medication to use? So in the future, last two to three decades, actually beginning of 2000, Miss Sarah, there's it comes in the market of some of the countries, and it is then just came with the news that this is the alternative of non-steroidal. It is an alternative of opioid. This is a wonderful drug, some things like that, and this is becoming common due to increasing prevalence. You know that globally the chronic pain is increasing, the arthritis, the chronic pain reasons. So, and we also, the country like ours, we don't have a narcotic, but the country like the developing countries, they have opioids. So they start using opioids for these such benign conditions like arthritis and all these things. In this context, two most studied cannabinoids in medical cannabis, जैसे हमने बात की अभी, the THC and CBD. THC के psychoactive effect हैं, although very good and analgesic anti-inflammatory. Currently, the THC also being tested for cancer recurrence, antioxidant, and the other activity like muscle relaxant, antispasmodic, these are all under trial. CBD, which is relatively a safe compared to THC because of the less or no psychoactive effects, there still people are using for anti-inflammatory pain, anticonvulsant, and anxiolysis. Common side effect, for any medication can cause nausea and vomiting. The cannabis in the beginning of the day can cause headache, drowsiness, and a little bit of dizziness. And less rare side effect, which is rare as far as literature is said, and I haven't seen anything because I haven't used for a long time. So my experience is not, and that way is not, uh, validated this statement. But generally, what is written is that it doesn't cause the dependence. A very rare cases may it can cause dependence, withdrawal symptoms, and psychosis. But otherwise, if you are using that, they're very suppressive. So we talk about the medical cannabis, what the medical cannabis is, and medical cannabis when the practitioner write down cannabis for some reason. So this is important that type 1 and type 3 we have been talking, but now here in between is the type 2, which is a hybrid type, which is a mix of the CBD and THC. So THC का आपको पता है कि the marijuana जो इस्तेमाल होता है, the people are using it for for pleasure and for high moods. So and this is woman doctors से पूछे बगैर people are using it. But one is the hybrid type, which is now available, which is the cannabis mixed with the ratio of CBD to THC. THC की भी मुद्दा डाल दी in the CBD, and just to reduces the side effect of THC. And the type 3 cannabis is the hemp, which is considered very, very safe. And here the cannabis high in CBD and very low in the THC. And majority of people are using the CBD cannabis, which has almost no or very little psychoactive side effects. So where can use this cannabis or medical cannabis? So 50% of the chronic pain patient, we know that the people who are doing pain clinics and pain practice, they know the patient often requires non-steroidal anti-inflammatory drug and opioids. And without them, even intervention you cannot do very frequently. So we have very limited option. Patient's pain is not controlled by simple analgesic like paracetamol. The patient cannot afford the long-term use of non-steroidal, and then what to do? So in that case, this is a very good alternative, cannabinoids, and this is alternative to opioids, and also the NSAID. Increasing number of publication over the last 2 decades give new insight about this mechanism, efficacy, and safety of cannabinoids, which we just discussed. Now, based on the current supportive literature, cannabis is becoming one of the most commonly used substances worldwide. This, whenever we read this kind of papers, the Cochrane review and this pharmacy paper, then certainly we really want to use it because every day we find so many patients who are coming with the pain, and we cannot prescribe non-steroidal and what words. Now, apart from, I really want to give some of the down part of the cannabis, and its use currently is legal in America, some part of America, some states of America, the Canada, some part of Europe, Germany, Israel. There are so many countries. But if you see academic guidelines, then even the NICE, which is the National Institute for Health and Care Excellence, and 2019, after that they didn't review the guidelines, and that time they did not recommend the cannabinoids for chronic pain directly, but they said if somebody has already started this cannabis for the chronic pain, then continue the treatment until the new guidelines are published, and still there's no new guidelines published from NICE. Similarly, ISP also said that because ISP is very research based, evidence based pain organization, and they does not endorse the general use of cannabis until recently. And they said that until we have a good clinical trial, we cannot put this medication into the recommended guidelines. There are many ways to use these cannabis. The dried flowers of the cannabis is very good because in this dried flower of cannabis, uh, they can easily be taken out from that and standardized, and control composition can be prepared. Uh, in the form of smoke or in the form of spray, and even in the form of some oral preparation. A number of recent literature suggest that type 1 cannabis, which is high in THC, yeah, that's marijuana, they may provide pain relief in a rough form with little side effects. But recent epidemiological study shows that the chronic pain syndrome are the main reason. More than 40% people taking medical cannabis, which is rich in THC, which is a type 1. Normally, we recommend the type 3 majority of patients, but the literature में ज़्यादा मौजूद है, and the refractory pain, the patients are not getting pain relief. So 40% of the patients who got the pain relief, they are rich in THC, which is a type 1. The very few randomized control trial investigating the smoke cannabis flowers for chronic pain, so we don't have much data, although it seems that the control use of cannabis is relatively safe, where we can see the milligram and the strength and all these things. We should remember always that the psychoactive effect, although when we use it type 3, then there's hardly a chance, but nevertheless, we should keep a very close eye on both type of cannabis use. THC is known for all these things. They have their dizziness, sedation, but for the other also, we need to take. Cannabis extract can also be delivered orally or by the transdermal route. If you go to the various superstore, supermarket of Germany or Canada or even Italy, you find that in superstore, this cannabis candy, cannabis lollipop, cannabis chewing gum, cannabis cream. So they're freely available. There's no, because in the country has allowed legally, and there are variety of forms are available to chewing gum se leke and spray and cream, so many varieties are available for this herbal cannabis. You know that WHO, I'm not in that context I'm talking, but I'm talking that the WHO also promote the typical non-medication therapy for pain. And I'm not saying that this is not a medication. Of course, is a medical cannabis is just like a medication, but considering is many positive side effects, we can take that kind of a recommendation from WHO to support the use of cannabis for a variety of conditions. Nabiximol is a very famous preparation. It is not a pure substance, but a mixture of two extracts. जो हमने बात की थी ना hybrid वाले. So this is very popular. The THC भी इसमें शामिल हो गए and the CBD is ratio 1:1. Usually it is administered as an oral ethanolic spray, usually for the treatment of chronic central neuropathic pain. Nabiximol in some of the countries is standard of care for neuropathic pain. Diabetic patient just spray ले लिया 2 दफा and they are much better compared to the neuromodulation drug and side effects. The combination of THC with CBD in nabiximol may improve the tolerability and safety of THC because THC pure nahi hai, is a 1:1, so it has less neurological and psychiatric side effects, and yet they relieve pain and the other symptoms. It works on anxiety, or works on cognitive impairment and paranoia. Several randomized clinical trials have demonstrated the safety and efficacy of nabiximol in central and neuropathic pain, rheumatoid arthritis, and cancer. So the nabiximol, which is a combination of THC and CBD, is a very popular. The dose required in spray is very minimal. Even the THC dose is minimal and rapidly absorbed. So the typical side effect, the psychoactive side effects are much less. Then two other combination, dronabinol and nebulor. Again, two very important, uh, spray form, and I'm not sure about the cream, but the spray form mainly. They primarily psychoactive, so it is different from the nabiximol. They are mainly THC dominant. And they also, a synthetic cannabinoids is not just very similar to THC, but does not occur naturally and is 5 to 10 times more potent. Again, just remember that the compare with these cannabis with the opioids. So sometimes the synthetic opioids, which जो हम बना रहे हैं, the tramadol or all these things. So the tramadol is not as potent as morphine. But here the synthetic nabilenol, it is potent more than the THC. But it is claimed that it is formed in a way that the side effects are less, but the potency of its effect of the pain relief is better. A recent review concluded that the cannabinoids 5 to 20 milligram per oral and 4 milligram of nitrogen analog of THC are no more effective than codeine in controlling pain and have depressant effect on central nervous system. So, uh, always keep your options in mind open because nothing is ideal. No medication, no, nothing is ideal. And whenever we talk about, even when we talk about any medication, जो हमारी currently हम use करते हैं, it is not ED 100, it is ED 65, ED 60, मतलब 65% of patient में this drug would, affect 70% may affect hoga. So similarly, you will not find all the literature supporting the cannabis, but there's so many literature supporting the cannabis that one can consider considering the other options of non-steroidal and the opioids. So CBD effects are different from those of THC, जिस हमने बात की थी. They are relatively benign as compared to THC, although they are very similar chemically. Pure CBD is not interchangeable with CBD rich cultivator. Hemp oil जो बहुत इस्तेमाल होता था, I heard that अभी भी इस्तेमाल हो रहा है, but certainly I'm not using it because it is not legally allowed. But when a temporary period of 6 months when it was allowed temporarily, then we have used it, the CBD oils and the hemp oils, but not purely for neuropathic pain. So I have no experience, but basically we were using alternative to opioids for cancer pain and some chronic, pain like arthritis not relieved by the non-steroidal or non-steroidal is not important. Hemp oil are extracted with the more or less CBD, usually with a TSS concentration below 0.2 to 0.3%, and containing numerous other plants ingredients. CBD is not a controlled substance, and remember, and it has no psychomimetic effects. According to cross-section study, almost 62% of users of CBD-rich cannabis cultivator, hemp type of cannabis, report taking CBD to treat a medical condition, with the top three being anxiety, pain, and depression. So the current literature बताता है the three common indication. One is the pain, other is the anxiety, and the third depression. And people who practicing pain, you know that pain is invariably present with some degree of depression. Anxiety depends on that, but the depression is almost more or less the same. CBD has a good safety profile, as has been confirmed recently by WHO, as I mentioned before. Pure CBD does not cause adverse neurological and psychiatric effects such as high moods and pleasure के लिए इस्तेमाल होता है high marijuana, poor memory, disorientation, confusion, and the possibly counteracts the drug abuse and dependence. This is not the case. Very important issue is regulatory and ethical consideration. But I believe that until it is allowed legally in the country, we should not use it. Although we should keep doing research lab, we should keep studying, reading what is the status worldwide. But as it is not legally allowed, so we cannot use it. Prescribing challenges for physician. Certainly, in Pakistan, even when we allowed to use it, there are very few preparations available, and we were thinking, and that was the reason of entering into the area of research for this cannabis. That we thought that we have a lot of locally grown cannabis, and we can make our own medicines in our country for our own people, just to relieve pain and decrease the sufferings. There is a ethical debate that some of the patients who want to use recreational purpose, whether we should allow or not. So certainly, this debate is ongoing. Some of the people think that even if the patient has right to use it recreational purpose as the other recreational drugs are being used, but certainly still there is no uh, words about the final words about that. Now, the points of ending this topic, the cannabis and chronic pain, hope or hype. So, no doubt that cannabis has gained attention in the last 2 to 3 decades as a potential treatment for chronic pain, with some studies suggesting cannabinoids like THC and CBD that may help reduce inflammation and modulate pain signals. So, it is a kind of a non-steroidal anti-inflammatory drugs alternative. Patient reports relief from conditions like neuropathy, arthritis, and multiple sclerosis. But clinical evidence remain mixed, as I told you, because a lot of studies are being done. Some have a majority have a positive, but there's some which shows not as good effect as the others. While some find it transformative, other question is long-term efficacy, risks such as dependency or cognitive effects, because uh, currently, we have a population that are being on cannabis for maybe for years, but not for decades and decades. So for long-term use that the people are using for 25 years or 20 years, we cannot say right now. But currently, the people are using for years and 3 years, or 2.5 years, and they still they don't see this side effects of dependency. Certainly, we need research for all these things, and this debate continue until medical or जो भी हमारे guidelines evolve नहीं होती. So we believe that there is a hope that that cannabis or cannabinoids has emerged as a potential option for chronic pain. We know that there's a large gap exists between preclinical studies and the clinical trials on the efficacy, but certainly this is a limitation. Some studies very clearly, the clinical trials suggest that it helps neuropathic pain and improve quality of life in the patient, diabetic patient suffering from neuropathic pain. However, again, the evidence remains mixed with the limited large-scale clinical trials. There is an urgent need felt for the high-quality randomized controlled trial. I believe in that for assessing the effectiveness and safety of the cannabis, खास तौर पे the locally grown cannabis, which is abundance in Pakistan, and we can use it if it be found effective. Well, the cannabis holds promise. It is still uncertain whether it is a breakthrough or just another trend. And maybe after 30 years, we may not be here, but maybe the other generation is talking about why people use for a long time. But certainly, for now, it is cautious blend of hope and hype. And certainly, we should keep a high hopes to find any alternative of non-steroidal anti-inflammatory drug or the opioids to make our patient pain-free with good quality of life. Thank you very much.
Thank you, madam. We have some questions in the chat box. If you can please read. Okay, so first question is, can you please tell us about the dosage of cannabis?
Okay, so as I told you before, that cannabis currently the available in Pakistan is a very limited, like for example, hemp oil. Okay, 5 milligram, 10 milligram, 15 milligram. So normally, because this is not a very fine clinical trials as far as when oil is confirmed, जो spray हैं, जो 0.2, 0.3 milligram वाले हैं, वो 2 to 3 times depending on the neuropathic pain, we can prescribe three times spray भी है, sometimes लोग 1 spray भी लेते हैं 0.2, 0.3 milligram का. But जो hemp oil है, that is 10 milligram, 5 milligram, 15 milligram, 20 milligram. It all depends on how much you relieve by this. 3 to 4 times भी दे देते हैं, 10 भी दे देते हैं, 5. The very flexible thing. Because ये जो plant की जो medicines हैं, जो certainly अभी इतनी sophisticated clinical trials से effective ED50, ED65, ED75 अभी तक नहीं निकली हैं. But जो doses निकली हैं वो साइड इफेक्ट देखते हुए निकली हैं कि साइड इफेक्ट्स पर हो रहा है नहीं हो रहा. सो दिस आर अ वेरी सेंसिटिव काइंड ऑफ अ मेडिकेशन जिसको आप डोज जैसे हम मॉर्फिन में ख्याल रखते हैं या किसी और मेडिकेशन में रखते हैं, इट इज नॉट दैट. सो यस, हेम्प ऑयल कैन बी गिवन एक चमचे में नॉर्मली, एक ड्रॉपर में नॉर्मली 5 मिलीग्राम वाला ड्रॉपर भी होता है, 10 का भी होता है, 15 का भी होता है. करेंटली तो सर्टेन एज आई टोल्ड यू बिकॉज लीगली अलाउड नहीं है, आई एम नॉट यूजिंग इट. I know some of the people practicing in Lahore, they are making, I don't know how they are making, but they are prescribing this hemp oil and other forms to their patient. But as I told you, I'm very clear until the government make it legal, we should not prescribe.
Madam, we have another question. How do you approach cannabis in your multimodal pain protocols when you practice in regions where it is legal? Can you share some practical insights that might help us prepare if policies change in the future? In jurisdictions where both are legal, how are clinicians deciding between initiating cannabis or opioids as first line agent in chronic pain patients, and what can we learn from those experiences?
So the countries where they are being used, for example, Canada is in all the states, it is legally allowed. In America, I think the major सात आठ states में allowed हो गया. So here we are actually getting a population which had been on opioids or non-steroidal. And now we want to change it. The one population is that the patient were on the opioids and now they found there's a problem with the opioid epidemics, and we want to change the opioid to the other medications. So one population is that where the opioid changed to these cannabis. And as I told you, they are freely available in all forms. It's a very loose, prescription, whatever way they want to use it, spray or, lollipops or whatever. So one population is that the people have been on opioids and now we want to change it. Now, secondly, because it is not still in the current guidelines. Now, current guidelines, we're talking about multidisciplinary current guidelines. तो NICE की हैं, WHO ने साइड में दे दिया है, but this not in the pain. Certainly किसी rheumatoid arthritis में नहीं लिखा हुआ नहीं, but generally लिखा हुआ है कि the non-steroidal anti-inflammatory drug, if you want to replace non-steroidal, and we cannot use it non-steroidal for long term, and the patient has a problem where you cannot use it, then this is a good alternative of non-steroidal anti-inflammatory drug, and you don't need a close monitoring. The advantage of this cannabis up till now, you never know the future it comes and some side effect comes and start blaming. But currently, close monitoring is not required at the other medication when we use, because this is the plant original medication is not as sensitive as the other one. So one population is the non-alternative. And the third is the opioid alternative. The country where the opioids are not available, certainly we have to see as an alternative. In that case, we are actually will be using these medication for cancer first, because we really want to use, and an opioid is a recommended medication for cancer. But if, for example, there is a shortage of, and we all know that the 90% of the morphine from which is जो हम बना रहे हैं is going to the developed country, which is 10%. So 90% लोगों के पास तो है ही नहीं ये opioid. Certainly the good opioid alternative, which is the first indication of cannabis. So hopefully insight to इसकी ये है कि cannabis certainly would come emerged, and as American states ने legally allow कर दिया है, people normally look up, follow करते हैं अमेरिका को कि वो FD ने अप्रूव कर लिया, so that means it is. So there's a fair chances. In Pakistan, the reasons are beyond the academics. There's so other reasons why in Pakistan it is not legally allowed. Even the pharmaceutical companies that brought the major project of this cannabis to make this cannabis here in Pakistan, because we have a lot of cannabis locally grown here. उनको लगता था कि it's easy to make it, but certainly everything is now closed right now. People are making it. I don't know what is the way, but certainly जैसे marijuana बना लेते हैं, गाँव में लोग बना लेते हैं, उसको हुक्के में इस्तेमाल कर लेते हैं, स्मोक में इस्तेमाल कर लेते हैं, they get a pleasure. So उसको इसी तरह लोग इस्तेमाल कर.
Okay, madam, I think last question. Given the limited legal availability of medical cannabis in Pakistan, how can we ethically and effectively counsel patients who ask about it after reading online?
सो लीगली तो भी अलाउड ही नहीं है, तो हम किसी पेशेंट को कन्विंस नहीं कर सकते ना. वी कैन नॉट कन्विंस अ पेशेंट कि आप इस्तेमाल कर लें, बिकॉज यू नो एज ए गुड सिटीजन ऑफ अ कंट्री वी विल नॉट डू एनीथिंग जो लीगली ना हो ना. सो हमारे पास तो ऑप्शन अभी फिलहाल नहीं है. मे बी इन फ्यूचर इट कम्स एंड आई होप दैट फ्यूचर इट कम्स, ये आएगा लीगली, लीगल हो जाएगा, बट करेंटली इट इज नॉट लीगल. सो वी कैन नॉट कन्विंस आवर पेशेंट. हाँ, पेशेंट आते हैं कभी, कहते हैं कि उस जगह पे मिल रही है, डॉक्टर साहब मैं इस्तेमाल करूँ, तो हम उनको एकेडमिकली हम बता सकते हैं नुकसान फायदे कुछ नहीं, लेकिन हम लिख नहीं सकते. एंड दिस इज वेरी इंपॉर्टेंट टू अंडरस्टैंड दैट इफ द पेशेंट कम्स टू यू एंड आस्क कि प्रिस्क्राइब कर दें, तो सर्टेनली आई वुड नॉट प्रिस्क्राइब, बिकॉज मुझे पता है कि यहाँ लीगली अलाउड नहीं है पाकिस्तान में, तो मैं अपना प्रिस्क्रिप्शन तो नहीं लिख के दूंगी, ठीक है. बट पेशेंट कहता है डॉक्टर साहब उस जगह पे तो मिल रही है, और मैं तो इतनी पेन में हूँ कि तो है नहीं, तो क्या मैं इसका इसका मसला क्या है, तो हम बता देते हैं कि देखिए अलाउड नहीं है. वैसे ड्रग दुनिया में इस्तेमाल हो रही है, अमेरिका में हो रही है, कनाडा में, ये फवायद है इसके, तो वी कैन एजुकेट द पर्सन, बट वी कैन नॉट प्रिस्क्राइब, वी कैन नॉट एनकरेज कि मैं प्रिस्क्रिप्शन लिख दूं और ड्रग इज लीगली अलाउड नहीं. बट मरीज आके कहते हैं, मरीज आके बताते हैं कि उस अस्पताल की उस फार्मेसी पे मिल रही है. सर्टनली ज़्यादा हमारे सिस्टम में ज़्यादा अकाउंटेबिलिटी नहीं है एंड पीपल आर यूजिंग इट विदाउट. तो मैं उसके बारे में मेरे कमेंट ये है कि आई वुड नेवर प्रिस्क्राइब अंटिल आई एम वेटिंग फॉर द गवर्नमेंट ऑफ पाकिस्तान टू अलाउ. There are a lot of pharmaceutical company are negotiating with the government. We as a physician और हमारी जो लैब में जो, बिकॉज हमारे वी आर वर्किंग इन अ लैब रिसर्च, तो सर्टेन रिसर्च तो खैर अलाउड है, हम कर रहे हैं. मे बी रिजल्ट ऑफ दी रिसर्च में गिव देम अ पुश कि ये कैंसर को भी रिकरेंस को भी कम कर रहा है, डिमेंशिया भी कम कर रहा है, पेन भी ठीक कर रहा है, तो व्हाई नॉट.
Thank you, madam. Do we have some other questions from audience? Any more questions, please? Madam, if an RCT have to be conducted on patients, can we be allowed to use cannabis under prescribed dosage and guidelines?
नहीं बच्चे, वी कैन नॉट यूज इट लीगली पेशेंट में नहीं. आप क्लिनिकल ट्रायल एनिमल में कर सकते हैं, लैब में कर सकते हैं, बिकॉज अगर एक जगह ये कह दिया गया है कि लीगली अलाउड नहीं है, तो मैं किसी पेशेंट में भी इस्तेमाल नहीं कर सकती, ठीक है. हाँ, मैं एनिमल लैब और जो स्लाइड में जो बेसिकली हम कर रहे हैं, तो बेसिकली स्लाइड ह्यूमन टिश्यू की स्लाइड पर कर रहे हैं, जो कि फ्रोजन सेक्शन में जो आते हैं वापस टिश्यूज होते हैं, तो दैट इज अलाउड, बट नॉट इन द ह्यूमन चलते फिरते बंदे पे, जब तक कि ये सब कुछ अलाउ नहीं होता. आई नो दैट देर आर सो मेनी ग्रांट प्रोजेक्ट होल्ड पर हैं आजकल, जिन्होंने ग्रांट ले ली थी और दे आर वेटिंग. इनफैक्ट आई नो दैट सम ऑफ द लैब्स इन लाहौर इवन they were keen to start the trial, but ERC या ethical जो आपके कंसर्न होते हैं, उसमें आप ये नहीं कह सकते कि क्योंकि अमेरिका में इस्तेमाल हुई तो मुझे भी एथिकली यहाँ प्रूव करें, बिकॉज लीगल कवरेज आपका नहीं है, बिकॉज लीगल इज नॉट अलाउड. समथिंग हैपन देन यू हैव नो लाइक टू स्टैंड. हाँ, आप क्लिनिकल ट्रायल्स कर सकते हैं, एनिमल्स में कर सकते हैं, आप लैब्स में कर सकते हैं. अपने अपने बेसिक साइंसेज वालों को शामिल करें, फार्माकोलॉजी, द मेडिकल कॉलेज में जो डिपार्टमेंट ऑफ फार्माकोलॉजी एंड फिजियोलॉजी है, दे विल बी वेरी हेल्पफुल फॉर सच काइंड ऑफ अ रिसर्च. और वो यूज टू भी होते हैं ये माउस में सबमिट करने में. और आपका जो सवाल है कि न्यूरोपैथिक पेन उसको प्रोड्यूस करते हैं, न्यूरोपैथिक पेन को उसको देते हैं, उसमें देते हैं, तो वो दैट काइंड ऑफ स्टडी यस यू कैन डू अनटिल अनलेस कि आपकी चीजें और नहीं आ जाती.
Madam, question: hemp oil is used superficially, and does it has any side effects?
इसको हेम्प ऑयल का ऑयल को पिया जाता है एक्चुअली, और ड्रॉपर से पीते हैं, इट्स नॉट लगाने का नहीं, ठीक है. वो क्रीम होती है, वो पाकिस्तान में अवेलेबल नहीं है वो, लेकिन आप कहीं मुल्कों में आप सुपर स्टोर पे मिलती हैं. इज नॉट इवन प्रिस्क्राइब मेडिकेशन देयर. च्युइंगम्स, लॉलीपॉप्स, क्रीम, ये जो है ऑयल है, ये पिया जाता है ड्रॉपर पे.
Okay, madam, I think we are going to conclude the session. Thank you, madam, for delivering this topic, starting from basics to the evidence and making us memorize all the stuff that you presented. Thank you so much, madam.
Shukriya. Thank you very much. Thank you very much for the STSP law and you and everything is very good. Time pe ho gaya, time pe khatam. It's almost now 10 o'clock. Okay, ji. Thank you very much. Khuda
Thank you, madam.
Hafiz.
Perfect.
Hafiz. Hafiz.